Hello, welcome everybody. Welcome to the Power Your Health Q&A in May. Today we've got another super special guest. So if you're just joining us, if you're coming on in, go ahead and pop your name, where you're coming from in the chat. Let us know you're here. Give us a little wave. We're so excited for our guest tonight. I'm going to just give you a couple of announcements going in, and then I'm going to let our president, Mark Huberman, introduce her to us. But so tonight, this is our Power Your Health Q&A. We do it every fourth Tuesday at 4 p.m. Pacific time, 7 p.m. Eastern. And next month, we are not going to be meeting here for the Q&A because we have the National Health Association annual conference that's happening in person in Ohio. And you can catch it virtually. You can join us virtually live with some extra virtual. There's virtual only cool stuff that we're doing there as well. And we'll pop the link in the chat also so you can join us if you want to get your ticket for that. That's what we'll be doing next month. Without further ado, I think I'll bring Mark on here and we'll get started.
Hi, Michelle. Good to be back with all of you. I see everybody's piling in. I'm looking at the comments, and we got all kinds of people from Michigan and from Ohio and lots of good NHA friends. This is a really exciting show we got tonight. We have a true star in our midst that we're going to introduce you to. In the whole food, plant-based lifestyle medicine, there are people that kind of have carved out their niche and their specialties, and we've had the Sherzais, who are the brain health people, and Saray Stancic is the MS specialist. We've had cardiologists galore. We just had Dr. Will Bolsowitz, the gut doctor. Well, we've got the breast specialist today. And she is truly Dr. Kristi Funk, who's our guest today, is a board certified breast surgeon. She's co-founded with her husband, Andy, the Pink Lotus Breast Center in LA. She's helped guide celebrities like Angelina, Jolie, Sheryl Crow go through cancer treatment surgery. She's been a co-host on The Doctor. She's been on The View, Today show, Dr. Oz, Good Morning America, you name it, she's been on it. She knows from which she speaks. She has written a magnificent book that you'll all want to get called Breasts, the Owner's Manual. It came out in 2018. Every Woman's Guide to Reducing Cancer Risk, Making Treatment Choices, and Optimizing Outcomes for Core Belief. As I read it from the book, we have the power to reduce our breast cancer risk in achievable and dramatic ways, and of course, through a whole food, plant-based diet and lifestyle. She is a one-woman army for this. Her center does incredible work. And without further ado, it is my privilege to bring to this month's Power Your Health and the Dr. Kristi Funk. Dr. Funk, welcome.
Thank you. Thank you for that introduction, Mark. Hi, everybody. Super excited to be here.
Right. And right before we got on, she's not just a breast cancer expert, but she's a parenting expert, but she's got triplets who are now, 13 years old, you said?
They're coming on 13. They're like, hi, Mom. They've got little mustaches. I don't know who they
are. You get a Purple Heart just for that. It's just quite a thing. So anyway, it is a real privilege to have you here. And it is, to me, as I indicated, really always enlightening to me to see people in the lifestyle medicine, whole food, plant-based space that, have a specialty that they can bring that expertise to that particular area. We all know this diet and lifestyle is kind of a diet and lifestyle for all reasons, but the particular application to specific areas is really valuable to people. And it's really neat for us to be able to share the expertise that you've developed in your leading role in this field with our guests. We do have a lot of questions. So before I do, you just want to tell us you're board certified as a breast surgeon, right?
Well, board certified as a general surgeon, and I did a surgical breast oncology fellowship, for which there's no actual board certification. I did the fellowship at Cedars-Sinai in Los Angeles, where I was born and raised. I went to Stanford undergrad, UC Davis Med School. I trained in surgery, 5 years of surgery in Seattle, Washington, and then came back home, did the fellowship, and started my own practice in 2002. So it's been 20 years. And of those 20, 16 were woefully inadequately informed about the power of plant-based eating, the power of your daily choices, what you eat or don't eat, think or don't think, do and don't do, say and don't say, believe and don't believe about your life and your future possibilities and how that all impacts the cellular microenvironment inside our bodies. So, well, I'd say until 2016, 17, when I was writing the book and did my deep dive into all of the science to prove with facts that everything I wrote in that book, Breast, the Owner's Manual, would be true. It turned out to be quite revelatory for me in many respects, but mostly predominantly with respect to food choices. So I thought I had it down right, eating largely Mediterranean diet style. I mean, I knew McDonald's and bacon wasn't good, but chicken, turkey, fish, occasional cheese platter at a party, I thought it was all okay. And I'm just so excited to touch women where they have some fears or they have some history in their family or in themselves through this whole scary world of breast cancer. It's my privilege to come alongside them in this dark moment and light a candle that becomes a very bright flame for many of them.
So before just going further, so many people, even physicians in this space, are like my late great father said, most people don't worry about their health or do a fundamental change until after they've lost it. They've had a crisis. So Sarai Stancic, before she wrote Code Blue about her own challenges with MS, and other people have again had those. Was that the case with you? Did you have a breast cancer problem? Did you have a major health problem? Or did this just kind of happen? The light just went on by the research that you were looking at that just became unavoidable. Was there any personal health crisis that led you to this, to practicing whole food, plant-based lifestyle medicine?
There was not. There probably was just the simple of always needing to be right, which makes me delightful to be married to. And it was just that crisis moment of reading study after study in the Lancet, New England Journal, these reputable peer-reviewed journals, not like green leafy magazine, and just coming to the realization that I had been sadly very uninformed, not just misinformed really, but by my own medical training. I felt a little betrayed, to say the least, about the lack of nutrition science that we got, and its lack to the rate of zero, not one sentence said in all my.
It reminds me a little bit of what when I interviewed a cardiologist. He said that Kim Williams, cardiologist, he said there are two kinds of cardiologists: vegans and those that haven't read the data. And I guess that's kind of where you're coming from. There's no denying the science. It's there.
Absolutely. I try to use Kim Williams as an example to my cardiologist friends who have yet to understand the power in their food. And I'm like, your past president even makes it so crystal clear. But what you can do.
Well, again, this show, this Power Your Health Q&A this hour is all about our members and our guests that have posted questions for you. So without further ado, I'd like to get to some of them. And the first one I kind of didn't expect, but here we go. It was about IUDs and the IUD risks, and it kind of in that whole area of birth control. It says, are there any risks for breast cancer or other types of women's cancers associated with the use of IUDs as a birth control method? And if so, how can these risks be best managed?
That's an excellent question. People do worry about birth control, but you'll be happy to find out that there is an very, very, very tiny bump in risk for use of any kind of birth control. IUDs in particular are being brought up by this person because they have a little bit of estrogen, right, that diffuses into the local area of the uterus. And the big question is that systemically absorbed into your bloodstream? And then, if you don't know, 80% of all breast cancers are fed and fueled by estrogen. So an unnecessary excess of estrogen, whether you're eating it or putting it as a patch or cream, or swallowing it every day in a birth control pill, or have this IUD, this stent just diluting the estrogen into the tissues all day long, does that elevate risk? So here's the truth about this, and I call it a very tiny risk for this important reason. There were over 54 studies looking at oral contraceptive use and IUDs, and what they found was a tiny 24% increase in breast cancer risk for those while they're on these birth controls. And then the risk becomes 16% 4 years after stopping, and then 7% 5 to 9 years after stopping, and then 10 years out, there's no risk. But why do I call 24% so tiny? And this is like a quick stat lesson that I want you to understand, because when you pull out your breast cancer risk over a lifetime, yes, it's 1 in 8 women will get breast cancer. That's about 12.8% when you look at the charts. But in any given decade of life, your risk isn't 1 in 8, or we all have it by Christmas. Really, if you look at who's taking birth control, for example, let's just say you're in that range of 20 to 30 years old. That risk of getting breast cancer isn't 1 in 8, it's 1 in 237 women. So if you are taking birth control and it increases your risk by 24%, that becomes 1.24 in 237 women. See, so the risk is not tremendously elevated when you really look at the absolute risk, especially in your younger years when you're using an IUD. So think nothing of it. An unwanted pregnancy or horrific periods month after month is probably more unwelcome than this tiny, tiny risk, which, by the way, can be offset by smart diet and lifestyle choices.
And the same is true for the pill?
Exactly the same is true for the pill.
And no difference in the type of birth. I mean, I imagine there's various kinds of birth control pills available. They're all just as safe,
They're all just as safe. If a lesser dose often has fewer side effects, but all these studies looked at all doses and kind of arrived at this theme in most studies of about a 24% increase in risk. But again, transient only while you're on those birth controls.
Good. So I knew that the most frequent question I would get is the most frequent question you always get is about mammograms. It's a controversial subject, at least it's in the news a lot. And I have 4 different questions. Please advise, are they worthwhile or a greater risk over treatment and unnecessary treatment? At what age should we get them? Is there no significant personal or family history? If there's no personal or significant family history, there have been mixed reviews. Do you still recommend them? I'm living on 2 more. I'm living on a whole food plant-based diet and have had years of clean mammography screenings. Is it necessary to have an annual scan? I'm in my late 40s. I've seen the studies on the radiation exposure and the many unnecessary biopsies, et cetera, resulting from them. I know in your book you address this, but just wondered if it's truly a one-size-fits-all approach. And finally, what are your thoughts on thermography? Maybe we'll get to that next, but it's again, we know the standard recommendations. They've shifted over time. What's Dr. Funk's expertise, advice, reassurance, caution?
Yes. Okay. So this is such a loaded question, and I do individualize the response to the woman sitting in front of me, what her particular concerns are, what her actual risks are based on her personal history, family history, et cetera. But the bottom line kind of review that we can discuss together here is that it is true that mammograms, the radiation associated with mammograms, can cause breast cancer. If you take 10,000 women between the ages of 40 and 75 years old, and they have an annual mammogram, of those 10,000, 8 will get a radiation-induced breast cancer because of all those mammograms, but 800 will have a breast cancer diagnosed. So in other words, we find a whole lot more cancer than we cause using mammograms. The other pitfalls include besides radiation exposure and the sequelae of that, are just the discomfort with the squishing, right? And also false positives, which is when they call you back, say, we think we see something, but then at the end of the day, it turns out to be nothing. But it's usually not the end of the day. It's usually like, and we can't get you back for 2 weeks. So your mind is tumbling rapidly to the worst case scenario, and you have to go back. It's more radiation. Maybe it's a biopsy. The biopsy 9 out of 10 is benign, but you missed work. Someone had to take care of your kids. Like, there's a lot of costs involved that aren't dollar bills when you have false positives. So limiting that experience is worth a lot. And so that's where you have different societies, whether it's the USPTF or it's the American Cancer Society, the Society of Gynecologists, or mine, which is the American Society of Breast Surgeons. They keep differing in what they're telling you to do. Start at age 40. Nope. Start at age 50. Go every other year. Nope. Go every year. Stop at 74. Don't ever stop, right? Like, literally all these reputable organizations are giving mixed messages when it comes to mammography. And the reason is it's always a cost benefit analysis. And what is a cost to one group of people trying to put out solid guidelines is not necessarily as costly to another. And so, for example, with the USPTF guidelines, they looked at all the mammograms and said, how many mammograms do we have to do to save one life? Well, in your 40s, you have to do about 900. That's a lot. But in your 50s, you only have to do 1,300. That's better. So let's start at 50. 20% of all breast cancer in the United States is diagnosed in women under 50. So they're just supposed to like hopefully do self-breast exams and feel a lump. No, because they came out also saying self-breast exams are useless. Don't do them. They create too much anxiety and false positive visits to the doctor. So it is very individualized in my opinion. I officially kind of side for the general population at normal risk with my American Society of Breast Surgeons, which advises women to start mammograms at age 40 and to not stop or skip years until they think they're going to die in the next 10 years, which is admittedly a hard thing to predict. But in my individual practice, I have a lot of conversations with women. And if they are truly of normal risk and not dense breasted and are adverse to mammograms every year, I don't have any problem with them going every other year. And in the in-between years, maybe we'll do an ultrasound. If you're dense breasted, 50% of women are, then I always add screening ultrasound to the annual mammogram. So if you're dense and have no other real risk factors that truly elevate you, again, every other year is fine. And we can just keep on with the screening ultrasound, which is zero radiation. It's just sound waves. So there's no downside to that.
Has the technology and all that improved over the years like it has for dental x-rays? I know the amount of radiation and the amount of imagery that they're able to do is so much better than it used to be. Has that advanced here too, where the amount of exposure is where it's more precise, the exposure is less? Has there been a change in an improvement in technology from a safety standpoint?
No, what people don't know is it actually got a little worse. So we have our latest and greatest mammos, which are called 3D or tomosynthesis or tomo if you are cool. These have more radiation than the standard 2D mammography, but they do detect 34% more they have 17% more detection of breast cancer and 34% less callbacks for those false positives. So the imaging, if you liken it to, if you take a loaf of raisin bread and you smash it together and take a picture and you tell me, hey, Funk, go find the raisins, that's 2D mammograms. 3D mammogram, from your perspective, ladies, is still the same old squashing and one picture taken in those two directions. But what I see is literally a slice of raisin bread every millimeter through your breast. So I can have like 60 to 180 images of tiny little mammograms along the way. And aha, now I can pick out those raisins. So it's a tremendous visual advance and advantage that's happened with the advent of 3D mammography. But no, it is not less radiation, it's more.
So, but because of the precision or the greater view you can get, is that something you recommend people do because it's more precise? Is that is it a risk benefit calculation again?
It is. And in my opinion, benefit outweighs the risk of a little bump in radiation dose. But maybe for certain women, another reason to go every other year with the mammogram.
So, in that, the last question I was about to ask in this area that someone had asked is thermography. Is that what thermography is? Is this 3D or is this something else?
Thermography is very different, and I love it in theory. So thermography is really just like infrared technology looking at swirls of heat patterns in your breasts and creates this like psychedelic looking map of colors based on where the blood flow is. Angiogenesis, angio, blood vessel, genesis, birth. The birth of new blood vessels to cancers is an actual mandatory requirement of any type of cancer, including breast, if that cancer aspires to grow beyond the size of a tip of a ballpoint pen. So with extra blood flow comes extra heat. So the theory goes, when you have a thermogram of a breast, if there's an aggregated area of more blood flow and therefore more heat is emanating, that's suspicious. And I love the technology because it's so innocent. You just put like your hands in warm water, cold water, and you do this imaging, but it doesn't really translate into being better than the three things we already use: mammogram, ultrasound, and MRI. And I've seen it just be wildly wrong. Like I've had tumors breaking through skin. Well, I had a thermography just 6 months ago and it was fine. There's no way it could have been fine. I mean, that tumor did not grow that big that rapidly. So, and that's just one example, but I've over the years, I keep chasing down these swirls of heat because people come in with their mammograms and I try to feel something in the area, ultrasound something in the area, and I just find them wildly unreliable. And the irony with people who want thermograms is you can't do a thermogram guided biopsy of something suspicious. So you're still just married to the three modalities we always use: mammogram, ultrasound, MRI.
Got it. Someone asks about breast cysts. Are there any things, diet, supplements one can do to help eliminate or reduce breast cysts? I have dense breasts and always have cysts.
Cysts are these fluid-filled sacs that can develop in the breast. 85% of women have at least one cyst in their lifetime, so it's not uncommon. If they are completely non-tender, you don't feel them and they don't wig you out, you really don't have to worry about cysts. They are benign, except when they're termed complex or complicated cysts. Those visually on ultrasound have some stuff and debris or weird stuff inside of them that is still probably completely benign, but 1 in 1,000 will harbor cancerous cells. So if you want to decrease cyst formation, though, because your breasts are tender and it hurts you, a couple of things to think about. Limiting sodium intake will limit water retention. Caffeine and chocolate, coffee, green tea that's caffeinated, anywhere you're finding your caffeine. Caffeine can stimulate the production of cysts, but importantly, not breast cancer. Cysts are not breast cancer. So I just wanted to little shout out for my people who can't wake up without their coffee. There's actually data that the antioxidants in coffee can decrease breast cancer risk, even amongst BRCA mutation carriers. I will say, though, that it is a ridiculously high amount of coffee. It's 5 cups a day. But I digress. So back to cysts and how do we limit them? Soy has been protective against cysts in certain studies. And, there's really not much more than that. It's the caffeine connection mostly, and then the salt intake.
Before getting to another question, I did read your book before this. Was really light areas that guys don't usually pay attention to, all the details, all the moving parts that women have, but it was very interesting and revealing. But the most powerful thing that stuck out to me were the statistics that you cited: a 50 to 80% reduction in the risks of breast cancer by adopting a whole food, plant-based diet and all that. And that was powerful. And I will want to, before we leave, let you talk more about these proactive, preventative things we can do. But in the lifestyle medicine space, when I interview cardiologists from Caldwell Esselstyn to Kim Williams or Columbus Batiste, or if I interview people that are specialists in diabetes, the wonderful news they bring is that not only can you prevent these conditions from arising, but if you have them, you can actually clean your arteries by adopting this diet. You can actually eliminate your diabetes, your type 2 diabetes, and get off your insulin medication. So I guess I'm asking, in the area of breast cancer, somebody gets a diagnosis of a lump in their breast and has a biopsy. Does the whole food, in your experience, does changing a diet and lifestyle, is that an alternative or a viable alternative to having surgery or the conventional treatments that people get? Can you actually reverse breast cancer conditions, lumps and the like, through adopting a diet? In your experience, have you seen that for people to pursue that route before going the conventional treatment options?
I have seen complete reversal of invasive tumors and in situ, which is the step before it breaks the duct wall and then has the potential to get into the lymphatics and bloodstream and spread, in women who have two things. One, a very estrogen dominant tumor. And we measure that in a percentage of cells under the microscope that have an estrogen receptor on them. So if they have a high 90 to 100% of the cells are estrogen driven, and I have that woman go on an estrogen blocking pill, and then we dive headlong into let's go whole food plant-based, let's exercise regularly, let's start meditating or working on some stress reduction. Let's get you down to an ideal body weight. I'm a big proponent of both intermittent fasting and slightly longer 5-day fasting. And we kind of work out this plan. I have a growing population of patients who have had their cancers completely or 90% of those cells regress. Now, it's not a standalone treatment. The reason why I found that out was that we did still operate. But what I did in so far, like 6 women, they had big tumors that really had no choice but a mastectomy. And after we monitored the progress very religiously, like monthly, and at the 6-month mark, these tumors always got, in these ones I'm talking about, got small enough to convert what was a mastectomy into a lumpectomy. So they got to preserve their breasts. We are not yet at a point, we don't have that data that all of us kind of who want to hang our hat on, and that is a randomized controlled trial, right? Where we get very similar type tumors, and these 100 women start a dietary intervention, and these 100 move on with conventional treatment. Who has it recur? Who lives the longest? That data is never going to come. So I just have the privilege of working with individual women who are there to do surgery, conventional therapy. Most Western doctors in my field will kind of kick them to the curb entirely. Like I can't take care of you because you're not following the rules. Or they'll be polite about it, but just really think like, woohoo, wacky, don't know what you're trying to do. So I kind of meet them halfway because I don't think it's wacky, but I do think it's dangerous in a certain number of tumors. There are 21 subtypes of breast cancer. And for example, triple negative tumors are the most aggressive, rapidly dividing, and hardest to treat and cure that we come across. So if I have a woman with a large triple negative cancer, I don't mind if we try to avoid chemo and radiation or other therapies as much as I mind avoiding surgery. And the reason is this tumor had such a head start on you. It has behind the scenes for 5, maybe 10, maybe even more years, been recruiting all of the little things it needs and requires to exist, to proliferate, to eventually metastasize. And now it just came into your conscious awareness, and you're a decade late to this cancer battle. And if you're going to come after certain subtypes with kale, you're not going to win. But what can win is to like physically remove that cancer from the breast, right? Everything else we do after that is a betting odds kind of game. Well, if you don't radiate, there's a 40% chance that it's going to come back. But if you radiate, it'll become around 4 or 6. All right, well, you're saying 60% weren't going to come back, right? Or chemo, if you don't do it, there's a 30% chance it will come back metastatic. But if you do it, we can knock that down to 10%. Okay, well, there was a 70% chance it wasn't going to come back, right? But when there is, whatever size you want to give it, a peach pit of a tumor in your breast, we can let you do things and I can try to measure it and see if it's disappearing. But if it's not, and if it's growing, let's abort. Let's just get that out. And then all of your amazing intentions and good behaviors and dietary changes can now be doing something incredible. All these things you chew and swallow, all these things you think that are positive and decrease inflammatory mind-body connections in your body. What are you doing? You're setting a new anti-cancer landscape, and your new immune system is stoked to figure out, oh, wait, there's that one rogue cell flying through the blood. There's one rogue breast cancer cell landing in the liver. You can win that battle. You can win the battle against an army of scattered cells flying around. Do you know that a 1 centimeter tiny sugar cube of an invasive breast cancer has 1 billion invasive cells? So getting after 1 billion is a lot harder than just getting after a little shower of cells. Does that make sense?
Sure. And I imagine that the perspective that I gather as I read your book that you want to share with people is that tumors don't just arise. It's not 90%. It's not heredity. It's not your environment. It's not stress. It's your lifestyle. Diet and lifestyle is the biggest determinant. So if you have breast cancer and you have surgery and you have treatment, you remove the thing, the focus is preventing it from occurring Again, just
Exactly.
preventing it from occurring in the first place. That's what you're here. I gather that's the big message you're here to share.
Certainly. Where I want women to understand that the power in their choices has the capacity to maximally reduce risk of ever getting cancer in the first place. But if they've already had it, then we can't live the life we lived that led us to this breast cancer diagnosis. Just kind of like, okay, little surgery, radiation, maybe you even did the chemo and you're taking this anti-estrogen pill every day. But now you're saying, I treated it and nothing I did or said or thought or didn't do in the precursor to this diagnosis matters then on the other side. So you've got your like BCAC, your before cancer, after cancer life. And I think this is just the most pivotal, teachable, eyes wide open moment that a woman can encounter, is this diagnosis that literally just frightens her and makes her contemplate her own mortality. Do you really want to emerge from that going back to the same old, because that didn't serve you well, your breasts well, your cells well, and now probably your stress levels and your even marriages are affected, right? Relationships around you, all because of this pivotal moment. So let's turn that proverbial, lemons into lemonade. Let's turn it around and emerge through this experience just kind of blooming with a zest for life and appreciation for the fact that it's finite. But what are we going to do differently? And those things you should do differently actually, turns out, can have a number of evidence-based, research-backed, like proofs that they are always going to be working for you and never against you.
Got it. We have a bunch more questions I want to get to. One is about hormone replacement therapy and breast cancer. Could you please speak about hormone replacement therapy in relationship to breast cancer risk, specifically in relation to somebody in early menopause, early 40s?
So hormone replacement therapy absolutely is connected to causing breast cancer, but there's so many doses and formulations, and whether or not you have a uterus dictates whether or not you add progesterone into the estrogen. So kind of as just a once over arc of what this whole hormone thing is. It will come down to, just like the mammo question, an individualized discussion of what are you actually trying to get rid of here? Is it hot flashes, night sweats, vaginal dryness, decreased libido, itchy hair, thinning skin? You're chasing the fountain of youth, or do you have osteopenia and you're trying to build your bones? There are a number of reasons why women want to be on hormone replacement therapy and kind of get back to their 30s and 40s estrogenically in their bodies. But this will potentially harm you in the long run. The biggest study ever done on this was the randomized controlled trial that got from Women's Health Initiative, published in July 2002. And what they had done was they randomized 16,000 postmenopausal women with a uterus to taking something called Prempro, which is made from horse urine, but it's estrogen plus progesterone, versus a placebo. And they called the study quits at 5.2 years for ethical reasons, because the Prempro group had demonstrated a 26% increase in breast cancer over the placebo group. In addition to increased cardiovascular disease, increased dementia, they did have fewer bone fractures and fewer colon cancers. So that study rocked the world because everybody was writing these HRT, hormone replacement therapy prescriptions, right and left without really any cause for alarm or concern until this study came out. So over the immediate months after the study came out, all the OB-GYNs and internists who were writing the prescriptions, not all of them, but many, to the tune of 33 million prescriptions written annually for HRT, disappeared. And miraculously, in 2003, a mere 1 year later, after the rates of breast cancer had only gone up and up and up and up and up and up for the history of forever since we've been tracking breast cancers, plummeted 7% in 2003 in postmenopausal women with estrogen-driven tumors. So just the elimination of all that circulating hormone replacement in the population led to a dramatic drop in breast cancer. So it then bears what are my risks though, right? What's the individual's risk? And it's a little easier to think of it as a 1N rather than 26% increase. So as that study unfolded, they did further follow-up in the hormone group. And it all comes down to, if you put 147 women on hormone replacement, one will get a breast cancer from being on hormones. And that doesn't sound a lot until you extrapolate it back to the millions of women who are now on hormones again, including bioidenticals. And it's somewhere around 20,000 invasive cancers every year that don't have to happen, and they're happening.
Well, that's the next question. The bioidenticals is that it sounds so wholesome and whole food, plant based, and bio. So it's got to be healthy, right? So, is there any? Is this any better option?
It is, in my opinion, a better option if you're going to choose hormone replacement than the synthetic ones. I think we'll never know because these studies haven't been done. And yes, it does sound so sweet and pleasant coming from yams or soy, two of our favorite foods, but they're extremely adulterated, right? You're not just grinding up a yam in the food processor and rubbing it on you. It's been completely altered to be effective in this way. And it comes as creams and pills and suppositories and under the skin implants. It has so many changes from the healthful plant that it used to be. Does it have the same beneficial effects? Is it neutral? Or are there some detrimental effects that we'd see akin to the big WHI study? We don't really know for sure, but in January 2020, the UK came out with a really good paper that looked at 100,000 women on all forms of hormone replacement and included the BHRT, so the bioidenticals. And what they found was that for the women who were on estrogen plus progesterone, in 5 years' time, so this was pretty rapid, 1 in 50 would get a breast cancer attributable to the hormone use. If they were just on estrogen alone, it was 1 in 70. So there is something about adding the progesterone that is more worrisome, but even estrogen alone is problematic when it comes to breast. So here's the real question. What about you? Why do you want to be on it? And is there something gentler without side effects or problems that we could be using? So I've kind of scoured the earth my entire career looking for solutions to the problems, some of which I caused, right, by taking people off their hormone replacement therapy, for example. And I finally found something that had 3 randomized controlled trials in humans behind it, with blood draws showing it didn't elevate estrogen, with analysis of liver function to prove it didn't inhibit like the metabolism of drugs we often put people on, like Tamoxifen. So it's a 3 Asian herb blend. That's all that's in it. And it, most importantly, takes care of hot flashes, vaginal dryness, mood swings. Like it's called the Kupferman Index. There's 12 menopause miserable symptoms that women can have. And this addresses all of them. It's called Menopause Miracle. And it really lives up to its name. Like, people get really upset if they forget to reorder and then they're out of stock. They start hot flashing their way to a divorce. So Menopause Miracle is a very safe herbal blend. Acupuncture is very effective for hot flashes. Our friend Dr. Neil Barnard just came out with a publication 2 months ago saying that randomized soy consumption to not, people were given, like, I forget what it was exactly, like a cup of soybeans a day, dramatic decrease in their hot flashes. If it's vaginal dryness, there are lasers and topical treatments that are not estrogenic that can work. So on and on it goes. I kind of had this whole conversation based on what a woman's experiencing, and usually I can figure out how to make her happy again without adding in the breast cancer risk.
Linda Middlesworth, they just popped up a question from our good friend Linda Middlesworth, said, if one has breast cancer, what about Tamoxifen? Is Tamoxifen just net positive and net negative, a risk?
So Tamoxifen is, for the majority, a net positive, but we'll talk a little bit about it so you can understand more. What is Tamoxifen? It's an estrogen lookalike. So again, back to our known problem that 80% of breast cancers have a little receptor sitting on them. And when estrogen from your own ovary or from your own fat cells, so if you're menopausal, your ovaries have shut down or you had them out, from surgery, your only source of estrogen from your own body is everywhere you have a fat cell. There's an enzyme called aromatase, which is converting precursor steroids from your adrenal gland and making them into estrogen. Aha, is that why overweight or obese post-menopausal women have between 50 and 250% more breast cancer occurrence, recurrence, and death? Yes, it is. So being overweight or obese is bad for that very reason, about this fat cell there. So back to Tamoxifen, It is an estrogen decoy. It looks like it, but it fits the receptor on any straggler cell of this breast cancer that might be left behind in the breast after you do lumpectomy or flying around in the bloodstream. And it's like a car sitting in that parking spot you wanted, and your own estrogen, whether it's from your fat or your ovary, can't get in there and fuel the cancer to multiply and divide. And now the cancer is all sad. Without its estrogen food, it peters out and dies. So women who've had breast cancer who take tamoxifen have a 50% decrease in breast cancer recurrence. So yes, it's highly effective. Does it have side effects? Oh yeah. It's all menopause, bring it on strong, right? So hot flashes, night sweats, mood swings, on and on. Not in everybody, but it also has complications. Thankfully, they are very few and far between, but they can happen. 1 in 10,000 users will get uterine cancer from the tamoxifen. You can get cataracts and strokes and blood clots. Those are the big 4. So there are other things that some women can consider doing. Do I do food alone? Sure, if that's what a woman wants. I've got my top 18 anti-estrogenic foods list, which is just filled with delicious everyday foods. They're not obscure or ridiculously expensive. So we can come at cancer estrogen blockage in different ways, but the main ones are tamoxifen, the estrogen decoy, and a whole category of drugs called aromatase, back to the fat enzyme, aromatase inhibitors. So if you're menopausal, your ovaries are done, your only source is the fat, we just shut off that enzyme with a pill every day and you're not making any estrogen. You know what is one of the most potent aromatase inhibitors? Mushrooms. And then they analyzed in these studies which mushrooms. Like you'd think it would have to be, let's shout some bucks for the portobello or the fancy chanterelle. No, it was the complete cheapo white button. And it was 10 grams that would have the powerful aromatase inhibition. There's a study of Chinese women, and those who had the highest mushroom consumption compared to no mushroom eaters had a 64% decrease in breast cancer. The other powerful aromatase inhibitor in food, there are actually many more, but another biggie is soy. Soy in whatever form you would like to consume it, except soy protein isolate, which is pretty much devoid of all isoflavones. So your genistein and daidzein, they go out in those fat cells and they turn off the enzyme. So we can come at this with food, but one bad day and the fat wakes up and starts making some estrogen. So for the majority of again, these higher risk tumors, I like the combo. Let's try the pill. Let's see what your side effects are like. But man, I've got my Dr. Funk's antioxidant smoothie recipe you can find online. It's at pinklotus.com. And I've got this whole Power Up community. I'll tell you about it more later. But in there is my kitchen. And in the kitchen is the smoothie recipe. And the smoothie has 13 of the 18 anti-estrogenic foods in it because they all go together and are delicious.
Got it. When I interviewed last month Dr. Bolsowitz, one of the interesting things that was a number of questions that came out, and then he talked about them before and after, is when people, before they're scheduled for surgery or radiation or chemotherapy, when they have breast cancer, and afterwards, any recommendations for what people do before their surgery or before their treatment or after? We know we want them to change their diet and lifestyle, but are there any specific recommendations for people going through the process?
Right. I have a number of recommendations, like kind of like a list of things that I have people do in order to prep their bodies for surgery, and then in order to help detox from anesthesia afterwards and increase their wound healing capacity, like with vitamin C and with zinc. Some real practical advice is on my website has a blog, and it actually is the blog under Angelina Jolie's breast cancer journey. And I detailed out like all the things I had her do before she had 3 operations. So you can read all those. This is kind of a long list, but it's all really helpful. But the biggest thing is to be eating plant-based and high fiber. It's really critical that you eat a high fiber diet to help rid yourself of kind of all those medications that you get pumped into you when you go through surgery.
I think also in the owner's manual that you got here, there's also some of those recipes and smoothie suggestions and things like that are in the book too, right?
Yes, definitely.
Alcohol. This is an interesting question that I got from somebody. What percentage of daily intake of wine can contribute to the development of breast cancer? Daily 2 8 ounces of red wine by a female do you recommend avoiding all wine, all alcohol?
As an official doctor hat on my head, yes, all alcohol is a carcinogen. It's going to impair your immune system. It actually elevates estrogen. The big thing about alcohol, you swallow down acetaldehyde, which is a very potent carcinogen, and your immune system gets a little bop in the head every time you drink. So it's not as effective for you that day. The main driver, though, with alcohol and breast cancer risk, and really all cancer risk, is probably, based on some studies that I've seen, has to do with MTHFR, methyl tetrahydrofolate reductase, which is this enzyme that converts folic acid from your vitamins, folate from your leafy greens into its active form, the only form you really want, which is methyl tetrahydrofolate. So that methylated folate babysits the DNA as it divides. And it's like, oh, wait, you made a mistake. Let me fix that for you. There you go. Run along now and divide. Or, whoa, that's such a big mistake. Let me throw you out. So you need your methylfolate activated to be babysitting this DNA when it divides. When you drink, you knock out the methylfolate. And it turns out that 30 to 50% of all people on Earth already have a suboptimal MTHFR. They just genetically have one that's not churning away at a fast enough speed. You can test for that. If you have that mutation, you just need to ramp up the precursors, or you can take a methylfolate supplement. So when it was the women's health study, it was the nurses' health study too that looked at this idea of, okay, so if you have really high folate consumption on, like, you're front loading your enzyme, will you have as much breast cancer if you drink alcohol? So they took it's like 89,000 women, and they pulled out all the drinkers who had one or more drinks a day, and then they divided them into the high versus low folate consumption. And lo and behold, those who had high folate consumption had 89% less breast cancer. So there is something to this whole enzyme thing. You asked a very specific question. If you have, as a woman, a drink a day, breast cancer goes up by 7%. 2 drinks a day, 25 to 30%. 3 drinks a day, 40%. It's the high range when you're postmenopausal. So it's like 7% for a drink a day when you're premenopausal, and 10% for a drink a day when you're postmenopausal. And you can kind of just factor in, for quick math, like 10% increase in risk per drink that you have. Is there a safe amount to consume? There is. Studies suggest, and I will tell you, there's only one redemptive quality in all of the alcohols, and it's in red wine, and it's resveratrol. Resveratrol is a really potent antioxidant, and it's actually been studied as a standalone ingredient in cancer treatments. And red wine has another important property. Aromatase inhibition is another thing that goes out into those fat cells and turns off the enzyme. But you can get all of these benefits from the skin of red grapes, from blueberries. I'm not advocating that you are already a teetotaler and non-drinker. I'm not telling you to start drinking some red wine just to get these benefits. You can definitely get them from berries. But there's risk with alcohol. And the American Cancer Society says a drink a day for women, 2 drinks a day for men is cardioprotective, possibly, and not harmful. But that kind of data has been turned on its head by something called the J curve, where when they put all about the studies in alcohol, they threw into the non-drinking group all of the people who got so sick from drinking so much that they literally quit and they no longer drink, but then they were in the non-drinking group. So then if you put that as your null group for risk of breast cancer, having a drink a day seems to have less breast cancer than those who drink nothing a day, and maybe even 2 drinks a day, less than this person. And then boom, it hockey sticks up. And once you start having 3+ drinks a day, you have more cancer risk than this person over here who doesn't drink at all, advocating for 1 to 2 drinks a day down here. But the problem is, J-curve problem, they threw all the former drinkers in here. So you're not actually having a lifelong abstinence group over here. And when you go back in time, which they did, and pull out all of the truth and get rid of all the people who ever drank, now all of a sudden it's just a linear line like you would expect. The more you drink, the more disease you get.
By the way, just back to tamoxifen, Amy Desiree Goldstein popped a question in the chat here in the comments. What about flax seeds and mushrooms instead of tamoxifen?
I'm a big fan of that. The key becomes instead of, and this is becoming our theme for the hour, is that we need to look at the nitty gritty of your tumor details and how high risk is this thing to come back one day. The lignans in flax are potent aromatase inhibitors. They're phytoestrogens. There's tons of data that I love to talk about and how they dramatically reduce not only estrogen levels, but Ki-67. So one of my favorite studies on flax was that they had 30, it wasn't a huge study, 30 women who had a diagnosis of breast cancer. And so you can look on these core biopsies that diagnose certain factors. One of them, my favorite to talk about, is Ki-67. It's a division rate. It's the percentage of cells under the microscope that are actively one becoming two. They looked at the apoptosis rate. That's a fancy way of saying cancer cell suicide. So the higher the rate, the better, because these cells are popping and dying, right? And the other was CERB2, which is a marker of tumor aggression. All right, so we've got all these core biopsies, 30 women. We've got all this data on the front end, and now we're going to just do one thing. All of you stay the way you are. It doesn't matter if you're meat eaters, you're diabetic, you're just a slice of America, right? Nothing changed except everybody gets a muffin. Okay, junk food. So we add junk food in, except half of them have the equivalent of 2 tablespoons of ground flax seeds. A muffin a day, every day, for 5 weeks. Then you have your definitive surgery, and they remeasure the 3 markers from the core, right? What were they? My favorite, Ki-67, the division rate of the tumor, from 2 tablespoons of ground flax a day for just over a month, dropped by 34%. The apoptosis rate, that's tumor cell suicide, went up by 31%, and the expression of CERB2, that marker of aggression, went down by 71%, just from flax. So yes, there's a lot of power in our foods, the mushrooms I explained already. So can they eliminate the need for medications? Again, it's very individualized. It's hard to say.
There's a lot of power in plants.
That is indisputable.
There you go. A question that I did not get, but I was reading. The Week, a little weekly magazine I get today, and there was an article by Danica Patrick, and Danica Patrick was having her implants removed. She's the race car driver, kind of broke glass ceiling of race car drivers, and talked about all these problems. And since you are the breast expert here, I don't recall you talking in the book about. You talked about some implants and reconstruction, but we know that so much in the vanity world we are, women have augmentation and all this kind of thing. What is your view of implants? Is this something can be hazardous to your health? Do you caution against women doing this for vanity purposes or for?
I don't particularly caution them against it. I will say that there is no data whatsoever at all to support that implants can cause breast cancer. There's definitely no cause for concern whether you're silicone or saline. What you're putting in there is not going to cause cancer, but can it cause problems? Yeah, they can rupture, they can hurt, they can cause nerve damage, you can get infections. A newer, new-ish thing to enter the scene or our awareness, there are 2 of them. One is anaplastic large cell lymphoma, ALCL. This is a rare complication of having textured silicone implants, which have now been pulled from the market. And you will know if this is possibly happening to you because one breast will just be dramatically bigger than the other, like a cup size or more, whereas yesterday it was not, or a month ago it was not. The skin can be red or hot, and then it basically, the enlargement is actually fluid that's filled up there. The good news about this diagnosis is that even though it's a lymphoma and it's not a breast cancer, in 99% of cases, it is completely cured by removing the implant and that little capsule that forms around it. No chemo, no radiation, no death. A subset, though, will have let it unfortunately go on too long, and then they have more treatments and can even die from it. That's the only bad complication from implants. The other is breast implant illness. It's not an official diagnosis that you'll find with like a CPT code or ICD-10 code, I mean. It is this constellation of symptoms that women develop after having breast implants placed. I've seen it a number of times, countless times, in women who do it for augmentation. I've certainly only had 2 people after mastectomy. And again, it's really a subjective call, but it's the development of new things that you didn't have before you had the implants. And it's usually like memory fog, extreme fatigue, joint aches, irritable bowel, mood swings. It's just, unfortunately, there's not a blood test for it. Aha, that was from your implant. It's more of a constellation of vague symptoms. But in these women, when they get their implants out, their symptoms go away. So I don't really care if it's psychosomatic, like the mind just causing these symptoms to happen, or if there's something about the actual silicone in their bodies, in their breast area that's causing this autoimmune reaction or inflammatory change. All I know is that they didn't feel good as soon as they got the implants, and now they feel good now that they're out. So when it comes to my breast cancer patients in reconstruction, we have a lot of creative options. You can really use, even in thin women, I mean, they can't be like body mass index of 17, but in thin women, we have a lot of opportunities to use your own body fat and tissues. I have an amazing team of incredibly talented microvascular plastic surgeons who can transport parts of your stomach, your love handles, your outer thigh, your buttocks, your inner thigh. I mean, you name it, they can take it with its blood supply and hook it up under your breast skin after a mastectomy, and you can be just made up of all your own body tissues and fat, which has some significant advantages over implants.
A really good question was just posted as we're getting to the end. Do you, in your center and all that, do you offer second opinions? Are you available for consults? Can people come see you? Can people do it through telehealth?
Yes, you bet. I do it all the time. And one blessing from COVID was that the medical malpractice world now lets us do Zoom consultations, which I couldn't do before when you were out of state. So yes, for sure, you can always get in touch with me, pinklotus.com /care. And you can just write in an inquiry saying you'd like a consultation, and we'll call you and discuss your situation. And you and I can meet over Zoom, and I always record it and send it to you so you can reference it. And even if you have breast cancer and had another surgeon, or you're planning on staying at home, but you just want my whole breast cancer 101 download specific to your situation and my advice, more than happy. Is my reason for living. So please reach out.
That's awesome. Just a question, since you're such a leading figure in the breast cancer world with your center and all that, I wonder what your observation is of Susan B. Komen and all the millions and millions of dollars that are put into research and almost nothing in terms of prevention, lifestyle medicine. Is that a frustration of yours?
It's, I'm frustrated when I think about it. It's not like a daily frustration because I don't hyper focus on it, but I'm not a big fan of the Kentucky Fried Chicken pink buckets and the Yoplait yogurts and, all that money then going to, certain institutions that really are focused on, they're focused a lot on improving treatments, which is a lovely idea. But as Dean Ornish has become famous for saying, we just kind of need to turn the faucet off and stop mopping up the floor. And I think these trillions of dollars by now have really just been spent on trying to get better mops and not just the common sense of turning off the faucet,
By the way, one question that a lady is pregnant, we were talking about, she's scheduled for explant surgery coming up after 20 years of pain from the old saline breast implants. Any recommendations you have before and after in order to detox and reverse some of the issues that have appeared since the implants were placed?
Yeah, I do. I think there's I have this whole list. I think it's posted though. It's on our website under the Angelina Jolie blog. So that same thing would be all for you. Exactly what you need to do before, during, and after. Right, very specific. It's even 5 pills of arnica under the tongue when you wheel out. When you come back in, you need to have this tea for detox. And then there's like a lipophilic detox that happens through a tea. And then you bump up all the fiber-rich vegetables. But just read the blog. It's free. It's there on the website to find out the exact regimen that I recommend.
Okay, last question that I have for you is from mine, but to share with our viewers. Dr. Furman has his G-bombs and Michael Greger has his daily dozen, and you have the perfect plate. So would you share, for the benefit of those that have not read your book yet, what is the perfect plate that you recommend, Dr. Funk?
Oh, that's very sweet of you to bring it up. So my perfect plate is 70%, it's 70% vegetables and fruits. And then we have 15% healthy proteins like lentils, beans, peas, seeds, nuts. And then 15%, I'm sorry. I'm not even using my notes, so I messed up my own plate. 70% is vegetables, 15% is fruits, and 15% is healthy. No, I'm not. Oh my gosh, guys, don't listen to me. Just get my book. It is 70% fruits and vegetables, 15% whole grains, and that is the key, is whole. Oh my gosh, I'm a product of the 80s. I'm 53 now. So when I was growing up, bread, pasta, rice, and potatoes just made you fat. You were supposed to avoid all of that. When we became plant-based, it was like a whole world of whole wheat, whole grain, rye, barley, teff, amaranth, all these grains just enriched my life. So it's 15% that and 15% healthy proteins and 70% fruits and vegetables, usually with water or green tea on the side.
Got it. So your husband's role in all of this, your husband's role in the center, is he a physician himself?
He is not. So he was a socially responsible venture capitalist with his own firm when we met now 17 years ago. And we birthed the idea of the Pink Lotus Breast Center together while on a ski lift in Mammoth. So we were just brainstorming and decided this whole experience for women could be expedited and made more comfortable and uplifting than I was finding in these more sterile, large institutions with lots of different divisions. So thanks to him, Pink Lotus exists because he's been the business brain behind it all. There's so much like little stuff that isn't little in terms of the legalities of what needs to get done to have a center. So he takes care of all of the managerial aspects and the financial aspects, and I get to just show up and be the best surgeon I can be every day.
Got it. So you're, as you show on your little label here, you're at Dr. Kristi Funk on Instagram. You have a Facebook page. You have a website, I imagine. All of those. You're on YouTube.
I am. So pinklotus.com, and you'll find all the things we offer. But it's specific for your viewers. Power Up is this worldwide community that we've been busy creating that exists solely for the purposes of education and psychosocial support. We've got everything from groups that meet in person to my cook lives, which happen monthly. Like June 1st, I'm doing a Buddha Bowl live and giving lots of tips and tricks about why we're putting these certain ingredients into the foods. And then I have local chapters, so please check that out. We're in 23 major cities throughout the U.S. where you just sign up because you want to be a part of a community. We go on hikes. We've gone biking. I've got a 3-day camping trip coming up in LA. And one of my favorite newest things that I'm offering people is my summit. So I have a cancer kicking summit. It's appropriate for men and women, but largely the audience is women. It's live at the gorgeous oceanfront Terranea Resort, October 14, 15, 16, but every October, if this is not 2022 when you're watching. And I also have it as a downloadable virtual online that you can watch anytime, which is 11 and a half hours. And that is really going to keep evolving as I evolve in my knowledge and craft, but it deep dives into the orchard of your life and comes up with 10 trees that you have to plant to live the most fruitful existence. So obviously there's an eating tree, but there are 9 others that are all research-based, evidence-backed in terms of these habits will change your life, transform your life, and beautify it, perfect it to the best of your ability when followed.
And I gather, right before we came on the air, you were showing me your bicycle back there. You do practice what you preach, and you ride 6 miles a day, Downhill and then uphill?
And uphill. It's the uphill that's going to get me when I go home. But I do indeed. I ride that bike every day. My kids are completely whole food plant based and have been since the second we made it. It was like a 1 minute turnaround. We just emptied the fridge, and that was it 5 years ago. So we're
What about the venture capitalist? Is he on board too?
Not only is he on board, the day I decided that I needed to go plant-based, I went downstairs. I was like, Andy, honey, when the kids come home, what do you think about just going vegan? And he was like, oh, that'd be great. I haven't eaten this badly since I met you. So he's German, from Germany. So he had his mom was into alternative things. So he had a very clean life. When he met me, I sadly introduced him to organic, but disgusting, gonna kill you, turkey slices and my gourmet cheese platter. Like ridiculous way of eating, and tons of sashimi. So yes, he was right on board. And I will point out that he is a Ironman, full Ironman distance, right? 2.4 ocean swim and the 112 miles on the bike and the marathon at the end, Ironman. And he didn't bat an eye, and he didn't lose any fitness, and he's my champion.
That's awesome. Well, that's a great note to end on. It sounds like it's really a family affair. You're very blessed that way, and we're very blessed to have you. So thank you so much for sharing the hour with us. In fact, a little bit more than that, and hope we get to chat again sometime soon.
Me too. Thank you. Thank you, everyone.
You bet. All right. Well, thank you all. She's quite a dynamo, isn't she not? That's really awesome, and it is really a privilege of us in the NHA to keep bringing these Power Your Health Q&As to give you the opportunity to ask questions. Sorry I couldn't get to all your questions. I tried to pick and choose those that were, kind of most relevant to what she was talking about, but I think we did get to a great many of them today. So really appreciate all of you tuning in today, and it's just really great to see you, and great that we can offer this free service as part of the NHA. And speaking for the NHA, before we leave, I just want to share that we have as Michelle said earlier, that our conference in June, we won't have a Power Your Health Q&A in June because our NHA conference will be taking place June 24th to the 26th at the beautiful Embassy Suites in Cleveland. You can still register. That is an in-person event, and you can register at our website at healthscience.org. All your meals, SOS free, included for the weekend. You'll be part of a really sense of community, and in this post-COVID world, getting together with like-minded people and is an experience that just can't be matched. So we hope you can join us in person. But if you can't, and if airfares have gotten too high or your life situation is just too complicated, we are offering a wonderful virtual option that you can sign up for our website, where you have two things. You can live stream the entire event while it's going on. And then for that same $127 that you can sign up for, you gain the right to access all of the replays for up to a year after the event. It'll be just on a Vimeo channel, and it'll be just like watching YouTube. You can watch them anytime you want. So if you can't be there and sit there to live stream all the events, no worries. You'll be able to see them all, and you can sign up for that on our website at healthscience.org. We'd much prefer to see you in person, but we know you can't. We're probably close to 300 people already registered in Cleveland. So again, go to healthscience.org and you can sign up for the in-person conference or the virtual conference. And you can just do that again at healthscience.org. And finally, if you haven't already got it, the latest issue of Health Science Magazine, spring 2022, has a wonderful interview with Dr. Dean Ornish. All of our Health Science magazines, when you become a member, you can view them all and download all 44 years for free at healthscience.org. So, Michelle, anything you want to add here before we sign off?
Hey, I think you hit all the highlights. Yep, we're ready to go. I was just popping the links in there. If you guys, for your membership and the virtual conference and everything, it is in the chat. But thank you. Thanks this whole year for joining us and having all of the getting to see everybody, and we just enjoyed having you guys back every single time. So if you enjoyed the Power Your Health Q&A, if you want to keep going, let us know, send us an email, comment in the chat how you're enjoying it, and we'll see you at the conference next week.
Michelle and I are the hosts of the live stream, so if you don't see us, you'll see us virtually. And we had a good time doing it last year, and we're even a little more polished at doing it this year. So I think we'll do it a lot better. But we have a lot of fun.
Yeah. Yes. Yeah. So have a fabulous day, guys. Thanks so much for coming, and we'll see you in June.